Hi, I'm Lori Betts. Happy spring. Welcome to the Golden Years. My special guest this month is optometrist Dr. Don Kammer. So come on back.
I had a goat. Where did it go? To a family, where it turned into milk and income for medicine, school, clothing. A gift like that multiplies and raises a whole community out of poverty. That's the power of a single gift to Heifer International.
Welcome, Dr. Don Kammer. Thanks for
you.
coming on my show.
Absolutely, my pleasure.
It's always nice to talk to you, and I am a patient of yours, so you are a very good eye doctor.
Well, thank you very much. I appreciate that.
Our little visits get kind of crazy, but I know you know your stuff.
Thank you. Hey, I just want to say real quick, congratulations on your appearance in the Take a Look at Brunswick magazine for the recognition of all that you do, your works throughout the city, and your work here on Golden Years as well.
Well, thank
Excellent,
you.
absolutely.
Thank
So
you.
very good.
I got a lot of good feedback on that magazine.
I'd imagine you would, absolutely.
And I spoke from my heart, so
Good, it
Cindy
showed.
Schneider always told me, always talk from your heart.
And it's a good rule of thumb.
And
absolutely.
seniors are my field.
Yeah.
I love seniors.
Yeah.
And I want to help them out as
Yeah.
much as I can. So that's why you are my guest this month. We want to hear all about eyes.
Sure.
Because as you age, the eyes keep changing. And I want to know some good things that the seniors need to know about their eyes.
Sure.
Like how often, now my mother's one reason, she's 90 years old, she was going to the eye doctor twice a year.
Yep.
Now at that age, is that necessary? She did have a cataract way back when.
Okay. Well, everyone should have an eye examination on a yearly basis.
Okay.
And I'll say, depending upon the person's age, we'll tell you then why that individual should be seen. If we want to speak about the senior citizens, yearly, predominantly for the eye health. An individual who's had their eyes for a few years will typically be able to tell if they're seeing clear or blurry. Now, sometimes individuals will come in and they'll be surprised with what they say. But in an individual who, again, as the years go by, becomes a little bit more prone to eye health conditions, glaucomas, macular degeneration. You mentioned cataracts as a possibility. But then another thing, too, that a lot of people are surprised to find out are conditions of the body. Health conditions can cause eye problems also. For instance, high blood pressure, diabetes, everyone knows of those. And then sometimes the medications that we take can have ocular side effects as well. Anti-inflammatories for arthritis, prednisone, for instance, as a good example, can cause problems with the eyes, cataracts. And again, we want to have that patient come in on a routine basis. Once a year is typically enough to be examined. Now, you mentioned your mom having to come in every 6 months, then some eye conditions require more frequent following or making sure the eyes are staying healthy. For instance, again, with a diabetic patient, we'll say yearly is good, but if you're starting to show me signs of diabetes, we'll say, let's see you every 6 months. If those signs of diabetes become sight-threatening, then we may say we want to see you every 3 months. So it depends on sort of where you are in that disease process would then dictate how frequently you'd have your eyes checked.
Now you mentioned medications. Who's going to have the right answer? Okay, Mrs. Jones goes on a new medication. She's
Right.
not going to realize it's the drug she's
Right.
taking.
Right. Well, technically speaking, when you're prescribed a medication, you should have a conversation with the doctor who prescribed that medication for you. Not just why you're taking it, but then also the potential side effects that can happen. So that conversation should be had in your doctor's office, requested if you don't have it. The next place the conversation can occur would be with the pharmacist. You know, and it's too bad because pharmacy really is a profession that when we're mailing away for our
Yeah,
drugs and
that's
things like that,
gotta
we
be
have
an issue.
lost out on a very important part in our health care. So the pharmacist used to give conversation as far as that's concerned too. Now, fortunately, we do have access to internet. When I say we, I mean everybody has access where you can look up on your own to see what some of the side effects of the medicines are. But when you do come in, let's say, for instance, for the eye exam, I spend a lot of time talking with my patients before I even start checking the eyes to get all that information. What health conditions are you being treated for? And what medications are you taking? and I'm trained to know what those side effects are and how they relate to the eye health. And then if I don't, I have references that I'll pull right out in the exam room. I'm not proud, and I'll check them right there to make sure that we're checking for everything necessary.
And you are very thorough, and you do ask the 20 questions.
Yeah, yeah, definitely. I think that that's a huge part, again, that unfortunately can be lost if people are rushing through things and what have you. You want to make sure you're taking the time to talk with your doctor, have that conversation. And a good doctor doesn't mind having those conversations with patients.
And so along with the medications, I mean, any age, your eyes can just go through different cycles.
Absolutely. A child should be seen before 4 years of age. We are born with our eyes, and we're born with the sight center in our brain. But if you don't learn to use your eyes because there's something wrong, you may have prescription, the eyes might not line up properly, the eyes themselves may not be healthy. If you don't learn to use your eyes, then you'll never see properly. Getting into the years where when we're working and doing things like that, we're using our eyes differently than we have ever used them before. Computers, reading, etc. And computers don't damage the eyes, but they tax the eyes. They strain them. You're doing much more work with the eyes than we've ever done with them in before. And then when we start to turn 40, we start to lose that up-close focusing ability. That's a normal change that all of our eyes goes through. We need up-close help, different than the help that we need for distance. We end up wearing bifocals and things like that. And bifocals, not just in glasses, but they make bifocal contact lenses as well too, which again, the baby boomers are really looking for those types of options, and there's a lot of options with bifocal contact lenses. And then again, like we said, then into the senior years, more the health conditions, and that kind of covers the spectrum of, again, why you should be seen.
It's just a big gamut.
Well, there's again, you know, I feel to describe the eye is like a microcosm or a small or a representation of everywhere else of the body. It's a microcosm of the rest of the body.
So you could see what's going on
technically,
a little bit in the
yeah,
body?
well, for sure. And I kind of hesitate a bit because I don't want to insinuate that if a person has diabetes, we're going to see it in the eyes. Or if you have high blood sugar, we're going to see it in the eyes. It's not necessarily so. But there are certain instances, or many instances, where when we look inside of the eyes, there are changes that occurred due to those that the person did not realize that they had. So with the eye being a microcosm of the rest of the body, it's not just checking the eyes as a visual structure, it's also making sure the rest of the body is healthy at the same time as well too.
And eye changes, I mean, nothing is hereditary like cataracts. It's just a normal process of aging.
Well, there are certain ones that are and aren't, different eye diseases that are. You mentioned cataracts. The answer there is essentially no, it's not hereditary. If you live long enough, you're going to get cataracts. So I tell my patients, when you get a cataract, congratulations, you made it. Now, it's easy for me to say because I'm sitting over here and you're not over there, but the cataract surgeries are nothing like they used to be. In the old days, most individuals remember that having a cataract surgery meant you were admitted to the hospital, they had to pack your head in sandbags for 3 days, you had to remain immobile, and it wasn't all that long ago. Nowadays, it's a 9-minute outpatient procedure. The only time, and again, it's a very quick, painless procedure. The techniques that are used are just phenomenal. But to get back to it, cataracts though, no, that's a thing if you live long enough. Now, other health conditions, other eye diseases like glaucoma, now there, yes, a very strong hereditary link. If your parents have glaucoma, one of your parents had glaucoma, you're at a 50% increased risk of developing glaucoma. And glaucoma is a symptomless eye disease. It makes you go blind and you don't realize it. And people say, well, how could that be? Well, the reason is because a person loses their vision. Blindness is not blackness. It's not what it looks like when your eyes are closed. Blindness is nothingness. It's almost like what your vision looks like behind your head. And when a person has glaucoma, they lose their vision from the outside in. The peripheral vision is collapsing in. If it were black out here, you'd say something's wrong, but it's nothingness. And by the time a person realizes that they've lost this vision, it's too late. The optic nerve is dying, and it's a tragedy. And so we say it's symptomless. You don't feel, glaucoma being a disease of eye pressure, pressure building up in the eyes and crushing the optic nerve. None of that is felt. We don't feel any of that. So that type of an eye disease, yes, there's genetics there. It's an A symptomless type of an eye disease, again, only going to be caught if you're having your eyes checked on a routine basis. Other eye diseases, the jury's kind of out on. For instance, another one that most people have heard of is macular degeneration. In fact, we used to call it age-related macular degeneration because as people live, as the years go by for them, there isn't an argument that can be made that eventually everyone would develop macular degeneration because it's really a breakdown in the waste removal system in the retina. Sight happens, sight works by light entering the eyes, and the light gets onto the retinal tissue. A chemical reaction occurs. The chemical reaction creates little electrical impulses that are sensed by the nerves, and they're taken back to the sight center, and that's how we see. But with every chemical reaction, there's also waste products that are made. And in the eye, those waste products are called free radicals, and the free radicals are picked up by that waste removal system, removed out, reprocessed, removed, etc. But as time goes by, that waste removal system breaks down, and then those free radicals stay in the retinal tissue, and they do damage then to the surrounding tissues. And when that damage occurs to the retina, it's like the film in a camera being damaged. You lose vision that way. So the hereditary link, though, is yes, there is some hereditary there, but here more lifestyle decisions and changes and things that you can do could help with macular degeneration or help to avoid it or slow down the process.
Which?
Well, the biggest one really that we say is stop smoking. I hate to say this, but if a person is smoking, you don't love your eyes. It's the truth. Add me to the list of doctors who tell my patients all the time to stop smoking.
Well, then what about secondhand smoke?
There is if you're a smoker, it's a 3 times increased risk that you're going to develop macular degeneration. If you are exposed to secondhand smoke, 1.87 times increased. 2 times. 2 times. Two times. So smoking it yourself, 3 times increased risk. Secondhand smoke, nearly 2 times risk. So stop smoking, number 1. Number 2 is to try to lose some weight. Again, try to lose some weight and improve your diet. Healthy body, clean machine. You know, you
all
hate
our
to say,
body parts work together.
Exactly right. And you can't abuse and expect not to have damage occur. The eye, because the blood vessels within the eye are so fragile, so delicate, any pollutants that are put into the body end up in the retinal tissues. They accumulate there. So a person that smokes, when you smoke, you're introducing over 200 toxins into your body. And they accumulate in that retinal tissue and they cause damage. And if that waste removal system is already having a problem breaking down with time goes by, you could imagine introducing more waste into the system just does more damage. It's going to do more damage to the eye. So stop smoking, lose weight, try to improve your diet. There are some supplements that we can take, the antioxidant vitamins. I mentioned about the free radicals. The antioxidant vitamin goes into the retinal tissue, binds up with the free radical, makes it less harmful to the tissue. The omega-3s, the fish oils, flaxseed oils, exactly, fish oil, flaxseed oils, very, very good. And then the newest antioxidant, newest vitamins that we're hoping, and there's a study going on right now, is lutein and xanthine. Is 2 other antioxidants that are currently being studied, hoping that it's going to stop the progression of macular degeneration and even the formation of it. There's not a whole lot of evidence that taking the vitamins at this point can stop it from occurring, but when you're seen to have the signs of macular degeneration, that's when the vitamins particularly are found to be very, very helpful. And then new, relatively speaking, is there are surgeries and things that can be done to stop the progression of macular degeneration. There are injections and things that the retinal specialists, yes. So again, I mean, obviously never a good time to have macular degeneration, but things are looking up as far as that's concerned a little bit.
That's good. What causes dry eye?
Dry eye, first and foremost, 60% of everybody on the face of this earth has a clinically significant dry eye condition, absolutely. As time goes by, specifically relating it to that, we do nothing but dry out, unfortunately.
True.
The glands which secrete the tears, and there's 3 layers to our tears. There's 3 layers in the tears. And 2 of those layers of the tears, the top and bottom layer, typically will become deficient, unfortunately, and cause dryness. And a lot of people say, oh no, I don't have dry eyes. If anything, my eyes are constantly watering. That's actually the most common complaint of dry eye condition. And the reason for that is we have baseline tears. Tears which are supposed to keep our eyes moist. Like for instance in conversation right now, we have baseline tears that are supposed to be keeping our eyes moist. But if they would become deficient, the reflex tear, the tear that kicks in when, say, for instance, you get something in your eye, you feel something enter your eye, or we become emotional and we start to cry from emotion, those are reflex tears. So when the baseline tear, the higher quality baseline tear breaks down, the reflex tear kicks in, tries to flush the eye due to the irritation from the dryness. Now you've got tears streaming down your face because your eyes were too dry. And the reflex tears really don't do anything to lubricate the eye. Solution there, artificial tears, lubricating drops, over-the-counter products, not the read-out formulas. We want to try to avoid the read-out formula eye drops.
Because?
The medications in the read-out formula, first of all, you can become addicted to, not psychologically, but physiologically, meaning your body will always be looking, or excuse me, your eyes will always be looking for that read-out formula to keep your eyes from being bloodshot. The blood vessels themselves look for that medication, they swell up, and then they look for that medication to keep them down to a normal size, and if you don't put that medicine in, they're now swollen and the eyes will always be bloodshot. Also though, long-term exposure to those medications can actually make the pressure within your eye go up, which is glaucoma. Again, that symptomless eye disease. So the read-out products really should try to avoid them. Sometimes we use them if for specific reasons, but if your eyes are turning red, much better to treat the symptom of why they're turning red. So the artificial tears, the lubricating eye drops, and I hate to say it, the more expensive ones are typically better because there's better quality preservatives, there's better quality ingredients that are added to make it stick on your eye longer, to make them work longer action, and a routine use of the lubricating eye drop. Because if you use the drop when you become symptomatic, it's too late. If you feel the irritation, now the eye is irritated, it needs to be healed up by that lubricating eye drop before they start to see, and before they start to feel better. So I always tell my patients, it's better to keep the barn door closed by routine lubrication and 4 times a day. When you wake up in the morning, when you have your lunch, when you eat dinner, and when you go to bed, 4 times a day, routine lubrication is an excellent lubricating eye drop schedule. If you want to try a little homeopathic trick to get better secretion of tear, hot compress. Nothing fancy, take a washcloth under the faucet, just as hot as you can make it, and put it across your eyes for 4 minutes. 4 minutes. And if you do it twice per day, the glands which secrete the tears will secrete better quality tear for you.
We're going to take a real quick break, and we're going to come right back.
Excellent.
In the year 2000, Brunswick's history found a home at 4613 Laurel Road, now known to our community as Heritage Farm. Its mission is to preserve our past and showcase it for generations to come. Our volunteers have worked for decades collecting and archiving Brunswick's transition from a farming community to a bustling city. But over the years, nature takes its toll on historical artifacts and the places that hold them dear. We need your help to keep the memories safe. Becoming a member of the Brunswick Area Historical Society will help generate the funds necessary to keep the farm and the memories alive. Individual memberships start at just $15. Corporate giving starts at $100. And of course, your volunteer service at Heritage Farm is priceless. Join the drive to save our history. For membership information, visit us on the web at www.brunswickhistory.com.
Welcome back to the Golden Years, and I'm interviewing Dr. Don Kammer. And how long have you been an eye doctor?
Well, I've been an optometrist for 18 years now.
That's a long time.
Yeah, 18
and you're so
years.
young.
Right. Thank you. That's exactly what I tell everyone. It's exactly right. Yep.
Okay, I want you to tell Mrs. Jones, what is a good comprehensive eye exam? What
Sure.
does it entail?
Sure. You know, my definition of a good comprehensive eye exam begins with sitting down with that patient, like we said earlier, and talking about that history, the interview, the history. We call it the history.
Which is very important.
Absolutely. You have to talk to the patient. You could set a person down, see how well they see, give them an eyeglass prescription, and be done.
Out the door.
Out the door. There is no laws, there are no rules that state what we have to do in our eye examination. But I believe a good exam, again, starts with that history. Finding out how that person feels they see, how they use their eyes, how their health condition is, what their health conditions are, what medications they use, etc. What are your hobbies? What do you do? How do you use your eyes? Very, very important. Then it moves into the examination procedure, of course, determining if the person needs glasses, what glasses prescription is going to give the best vision, and then how are we going to give that patient as best vision possible. Again, glasses, contact lenses, etc. Refractive surgery, right? Refractive eye surgeries, things like that, all should be discussed. During the exam, making sure the eyes are working well as a team. Again, this is something very important for children, binocularity, how are the eyes working together as a team. And then finally, making sure the eyes are healthy. Making sure the eyes are healthy, like we said earlier, so very important, not just for vision itself, but then again, how it relates to our health of our body and those medications that we use.
Are you ever too old to do the eye surgery?
No, they're really not. Refractive eye surgery is really a procedure in which everyone could benefit from. If you fit within the criteria, there are more patients having the surgery done now than ever before. The procedures really allow a great deal of individuals to have the surgery that had never could have it done before. So again, refractive surgery is always an option and something that you can talk about with your eye doctor to see if it's something that you could do.
Are you ever too old for contacts?
No. You're really not. Again, as long as the person's able to put those lenses on the eyes and care for them properly, you're never too young or too old or too young. We fit children in contact lenses all the time. And not just for cosmetic reasons. For treatment of amblyopia or lazy eye, if you remember back.
Oh, lazy eye,
sure,
yeah. Is
sure.
that as common anymore?
Sure. Oh, absolutely, absolutely. Just as common. The causes that cause lazy eye, they're not going away. And instead of using the fabric patch, used to put the patch over the child's eye, now we use contact lenses instead. Now the parents have to be on board with that, but we have extended wear contacts that the little ones can sleep in. Parents learn to put them in, take them out. The children learn to take them out, put them in, take them out themselves.
Interesting.
Absolutely.
Technology.
It doesn't have to be that way like it used to be, where the kids used to make fun of each other because they wore patches and things like that. In fact, with the contact lens, it's a better form of vision correction. So the amblyopia training, the therapy itself works better when contact lenses are used.
All right, when you go in for the eye examination, I know dilation is very important.
Yeah.
Why is that so critical?
Making the pupils big with the dilating drops, very, very important. If we don't dilate the patient's pupils, if we don't put the drops in the eyes that makes the pupil big, I always say it's like calling a policeman to your house. You think there's someone in there, and he only wants to look through the keyhole. You want that policeman to open the door and step inside, and the dilation gives me that view. The pupil is nice and large, I shine bright lights, the pupil stays nice and large, and then I can use a variety of different instruments to see the inside of the eye to make sure they're healthy. In fact, with the pupil being dilated, with some of my instruments, I'm actually able to kind of bend the light and almost see behind the iris. I mean, that much of a view of the entire inside surface of the eyes. Because on the retina, that area responsible for vision, only a small portion is used for sight, but that whole inside eye is covered with retina. And if something's occurring way out in the periphery that I can't see, eventually when it works its way back into the area that you're trying to see with, it may be too late. So getting a heads up, an early heads up, always best as far as identification, and then success with treatment if necessary.
And your eyes are so valuable.
You only have two.
That's right.
You've only got two eyes. And, you know, and again, I am always taken by how fragile the human eye is. How fragile. And durable at the same time. It's like the body itself. It's an amazing machine. And again, you take care of that machine, clean machine, take care of your machine, and it's going to serve you best.
And through the examination, when you put puff air into the eye, what are you looking for then?
Yeah. The air puff test, that's one form of measuring the pressure within the eyes, making sure the eyes, again, don't have an increased pressure. Increased pressure within the eye is symptomless. Again, we have no way to tell that the pressure is increasing within our eye. So the air puff test is a measurement, a machine to measure what that pressure is within the eye. There's other ways that we can take the pressure. We can actually touch the eye with an instrument that tells what the pressure is. So that's, you know, they call that the glaucoma test, although there's more to diagnosing glaucoma than just the pressure. But again, measuring the pressure, very important in the eye exam. Many people say, well, what's my pressure and what's a normal pressure? And that's a little misleading because there's a wide range of what normal pressure is. And a long story short, just because you have a pressure within the normal range doesn't mean that you had a much lower pressure earlier on, or even the pressure within the eye that you have right now is not being able to be tolerated by the optic nerve. Because again, it's the pressure within the eye in glaucoma damaging the optic nerve. That's what glaucoma is. And sometimes the pressure stays the same, but the optic nerve's ability to tolerate any eye pressure, even your normal pressure, causes damage, and that's glaucoma also. So again, just having the air puff test done, that's why I wanted to say, just having that done, not enough to tell if you have glaucoma. It's got to be a little bit more thorough than that, a little more to do.
All right, what do you want to leave with Mrs. Jones? Some good tips, what they should look for, or just go out and get that eye exam?
I hate to say it because I know I'm the eye doctor, I'm the optometrist. I hate to say it, but again, as we said earlier, you've only got two eyes. So fragile, so precious. Eye examinations typically, by far, nowhere as near as the most expensive health type of visits you can have. Very reasonably priced, and they tell so much, not just about your eyes, your vision, but also health of the body as well too. And again, seeing, it's 80% of all perception involves the eyes, and that includes hearing and smelling and tasting, because when you see something, again, that's what your first cue is. So 80% of perception is vision, and if you don't take care of your eyes, go in, get an eye exam.
And I could hear better when I wear my glasses.
Absolutely. I tell patients that all the time. Please put your glasses on so you can hear me.
Well, Dr. Kammer, thank you so much for joining us
Absolutely.
on Golden Years. We will see you next month. Next month, we are going to have Laura Toth from the Office of Older Adults, and we will tell you what's going on in the senior calendar.